Psychiatrists from all over the world have come together to tackle some of the biggest issues in mental health today. As the APA annual meeting gets underway in New York City, this year's theme is Confronting Addiction, from prevention to recovery. And we cover it all right here on APA TV. Welcome back to APA TV here in the Javits Center in downtown New York. So beyond Broadway, we're going to look this week at some of the biggest issues facing psychiatry today. And one of the biggest of those is addiction. On the show today, we'll sit down with Patrick Kennedy to look at the legacy of the 1963 Community Mental Health Act.
Now is our moment to finally develop a mental health system. Not mental health services per se, but a system. We cannot wait. This is a formative moment in our history.
And examine the evidence for ADHD caused by digital tech addiction.
It's going to take a collective national discipline, quite honestly, to reduce our use of digital technology.
It is leading a monumental shift in how we approach all addictive disorder treatment,
as well as continuing our journey across the country to look at groups making a difference in mental health today. And where can you watch it? On screens around the venue, in select NYC hotels, on the APA meeting site, virtual platform and app, and on YouTube and X. But first to the driving force behind the last year of the APA's work in addiction. Let's sit down with APA President Dr. Petros Livonis to discuss this year's theme and his presidential initiative. Well, first of all, thank you ever so much indeed for joining us today. We very much appreciate it.
Thanks so much for having me here. It's always fun to talk with you, Steve.
So how important do you think this year's theme has been, and how has it affected the program itself?
It is important because we haven't done it before. As far as I can remember, we have tackled all kinds of topics in psychiatry, but we haven't had a presidential initiative on addiction itself. So I'm delighted that we're doing this year and that we're putting addiction in the forefront of our work.
So your presidential initiative on addiction spanned opioids, alcohol, technology and vaping. How big a challenge was it to cover all of those areas?
Well, what we did is we focused one at a time. So we had the first 3 months on vaping, the second 3 months on opioids to coincide with the recovery month in September, the next 3 months on alcohol coinciding with the holidays because people drink a little more during the holidays, and finally we ended up with the technological addictions in the spring. And that helped us organize the year and focus at one at a time.
And how did you think it went?
I think it went extremely well. I really think so. Under the leadership of Dr. Smita Das, who oversaw the entire presidential initiative. We worked hard, we had amazing teams, the staff of the APA provided amazing support, both communications, the advocacy, the government, Saul Levin himself. So we're extremely fortunate to get this work done in just 12 months.
So you mentioned Saul there. So obviously, as part of your presidential year, Saul leaving the APA. What do you think about that, and how do you see the health of the APA?
Well, big loss that we're losing Saul. He has been an incredible force over the past 11 years, brought us where we are today. But the good news here is that we have an amazing incoming CEO and medical director, Dr. Marquita Wills. I had the pleasure of getting to know her over the past few months, and I am so confident that the APA is in very good hands under Marquita's leadership.
Been a busy year for you as president. What are your final thoughts as that year comes to an end?
I'm happy that I'm leaving the APA in a very good shape on all kinds of fronts, and I give my very best wishes to Vis, the new president. Is going to be taking over on Wednesday. Vis, have an amazing year, have fun with it. It's a once-in-a-lifetime experience. I know that you'll do wonderful things for the APA.
Petros, thank you very much, and thank you for
Steve.
joining us.
Thank you.
Thank you. There's more work to be done, but it's great to see how Dr. Lavonis and the APA have been working hard to tackle addiction. Now though, to a team with groundbreaking approach to treating alcohol and substance use disorders, it's NorthStar Care.
My hope is to have NorthStar over time really create that same radical shift for patients who struggle with alcohol use disorder, and quite frankly, who struggle with any use disorder. The vast majority of this can and should, I believe, successfully be treated in the home. That's where patients' day-to-day lives are happening. So they're going to have better outcomes if we're there with them through their day-to-day over time. So as their stressors come up, we know how to help them cope with them. Medications, nutrients, remote monitoring, genetics, peer support, and navigation. Those are really the constructs upon which this company is based, which again mirrors what we do in chronic disease management. For every single patient we help, we know that it's impacting 20 more people. So every single patient, it's their family, their extended family, their close friends, the people they work with. So many people are impacted when they get better. So it's really, truly a gift to get to do this work and be able to help people.
ADHD is a major challenge for children and young people, with numbers growing annually. But can it be acquired later in life? And is digital tech the cause? We spoke to expert Wendy Waits to examine the evidence.
There's some evidence to suggest that children, high schoolers, and even adults can acquire ADHD symptoms as a result of overusing their digital technology. We, as a specialty, haven't quite decided if it's possible to acquire ADHD. Clinically, a lot of patients are coming in requesting treatment for inattention, but they don't have the neurodevelopmental history that would be required for a diagnosis of ADHD, and yet they're presenting with symptoms that impair their functioning, typically to the degree that we would want to treat them. So it's become kind of an ethical issue and a bit of a conundrum in our field. Until we define digital technology and define addiction to digital technology, we really can't measure whether or not those things might result in ADHD symptomatology. So that's kind of where the field is headed. This is the first time I've seen a real big focus on behavioral addictions at the APA, and it's really exciting to see that because it's been a big problem in our society and it's something we need to grapple with as a specialty. If people do come to my session, I prepared a handout that they can use for patients to try and just summarize some things they can do to decrease their use of digital technology. It's going to take a collective national discipline, quite honestly, to reduce our use of digital technology. The APA can take the lead in trying to advertise and spread the word about the dangers of overusing digital technology, not only to our brain function, our cognitive function, but even to our physical health as well. So I wish I could say I was more optimistic, but I think that we could be leaders in the field if we choose to and hopefully make an impact.
Fascinating insights into acquired ADHD there. Now, to LSU Health New Orleans, they're developing a comprehensive violence prevention program to decrease trauma, community violence, and intimate partner violence.
Psychiatry at LSU, I think, is a very progressive and dynamic department. We've been here for practically a century, taking care of patients with tremendous needs here throughout the New Orleans area and the entire region. I think our key themes are primary psychiatric care, running a large inpatient hospital setting. In addition, I think we have specialty care in areas like addiction and forensics, geriatrics, and CNL. So we hope the individuals will come to us for not only meet their primary needs, but also highest level specialty psychiatric care.
While we certainly teach gold standard psychiatric care, I think it's our activity in social psychiatry that's most important here and makes us really special. And it takes a lot of heart and passion. And our young faculty and residents are just amazing people.
I think that this is our time. So looking forward to great things for LSU New Orleans going forward.
The relationship we have to our increasingly digital world is ever changing, and understanding how to manage and define problematic use of everything from social media to video games, as well as gambling and pornography, is a major challenge for psychiatrists. Now, to discuss these issues, I'm joined by Dr. Mark Potenza and Dr. Sanya Bharani. Thanks for joining us today.
Thank you for having us.
Thank you for having us.
Now, some of the issues that we're talking about, gambling, pornography, social media, they're all distinct areas, so why are we taking them together?
One may think of these as distinct behaviors, but in many ways they intersect or overlap. So for example, the ways in which gaming and gambling intersect may be with respect to loot boxes or loot crates, which are elements within video games that are gambling-like elements. Similarly with gaming and pornography use and social media and pornography use, youth, for example, are often introduced to pornography through social media.
Gaming and social media are such large parts of everybody's lives these days. How does one see them as problematic?
They can be problematic in different ways. One way is in excessive engagement, problematic engagement that may be addictive.
Sonia, what does research tell us about the potential long-term implications of pornography on young people?
Yeah, I'm glad you asked because specifically referring to the youth that now lives in an era of the internet and has always grown up in the era of the internet. Online pornography is something that is ubiquitous almost, and variety is the name of the game, right? So having to consume that kind of content online oftentimes leads an individual to experience some sort of sensitization to various stimuli, wanting to have more and more of different things, placing sort of unrealistic expectation on a real human partner in the long term, besides having very obvious overlaps with more and more depression, anxiety, and resorting to all of these mechanisms or these ways of tackling stress in a high stress environment and keeping up with demands of daily life in a very maladaptive way.
We were talking a minute ago about addiction and social media. What are some of the challenges about talking to young people about addiction and social media?
I think that, and especially the country in which we live, and it's specific to the environments in which we function, right? I think that the problem is not being able to sort of decipher when it might lead to excessive use, right, and consume all of one's attention and time.
What about companies themselves? What can companies themselves do to help?
I think that they can work together with regulators, work together with researchers to make data available so that we can understand the nuances of the impacts of their products on people.
My final question to you both is that a lot of these are fairly new developments. So what can psychiatrists do?
A first step is asking about the behaviors, asking about the behaviors in a non-judgmental fashion, right, and getting an idea of the extent to which people engage in the behaviors and the extent to which they may be impacting their physical or mental health.
I would just add that clinicians would serve themselves and their practices better by making themselves more acquainted with right, these kinds of new, as you defined, addictions, and not to disregard them, and to know their associations with various psychiatric disorders, which we already define, right, if everything is about creating a strict diagnosis, but just to be aware and to know the basic questions to ask as to elicit where these problematic behaviors exist in a clinical space.
Well, thank you both so much indeed for joining us. Really, really interesting, so thank you.
Thank you very much.
Thank you. Thank you for having us.
Addiction affects all communities, but effective treatment requires culturally sensitive care, tailored to the communities we're working with. Let's take a look at some of the issues facing Arab American communities.
The rate of addiction in Arab American population, it is, I would say, because of the lack of awareness and the lack of reporting or presentation late, we don't have a lot of good information to say the gravity of the situation. However, it is common, it is a problem, and it ranges from something as simple as addiction to smoking, or vaping, or even using hookah, to something as severe as, recreational drug use.
understanding the difference between using the substance recreational versus addiction, and when they actually reach help, and who do they actually go to first. That's one of the major challenges that face the Arab American population here in the U.S.
It's a big challenge in the community, understanding that addiction is a disease and that it's not something the person is intentionally trying to get into. The presentation can be complex because they present later because of the stigma again and the shame behind it. One of the biggest things psychiatrists should be or can be aware of when they're treating Arab American youth is reluctance to treatment and medication. Because of the stigma and because of the shame, the approach tends to be preferred non-medication routes.
Don't make that assumption that just because the patient may look like coming from a certain religion, they might not use certain substance. So asking more curious questions about what they do growing up and using a lot of the information from the cultural formulation interview provided in the DSM-5 to help guide you figuring out what's the problem and how to ask for help.
Oftentimes, Arab American youth, they grow up in the United States. They are faced with a different approach to what addiction means, how to get treatment. And a lot of times the parents grew up outside of the United States and have a completely different approach. So understanding the dynamic there and how, the perception of addiction for the child versus the parents.
Faith can be tricky. In a way, it can be a protective reason for engaging in treatment and staying sober, but also can be a stressor and a reason to reach help later on in the journey. Conflict between your religious identity and being able to ask for help comes more actually for men at a lot of times. So this is one of the things that you be curious and being able to ask the patient certain question without judgment. The more you do that, the more you'll be able to get more information.
Let's take a look now at the example of the kind of care in action. Keystone Behavioral Health is working hard to provide accessible and culturally competent care to all individuals, regardless of their socioeconomic status or background.
Keystone Health is a community health center. A community health center is very important in a community because community health centers turn no one away. Doesn't matter what color you are, doesn't matter how much money you have or don't have, Keystone will provide services.
At Keystone Behavioral Health, we provide comprehensive mental health services to a diverse population of all ages. We do this in person and through telemedicine. In addition to your regular outpatient medication management and psychotherapy, we offer cutting-edge treatments like TMS and esketamine. What makes it really unique is that we provide these treatments in a rural area that is historically underserved.
Coming up, we sit down with Patrick Kennedy to discuss a century of community engagement in mental health. But first, to the Medical University of South Carolina. MUSC is devoted to innovative research as well as unique training and educational opportunities.
Medical University of South Carolina is the oldest college of medicine in the South, and as a result, the Department of Psychiatry, but it's also one of the oldest departments of psychiatry, not only in the South, but in the United States. The driver of the Department of Psychiatry is research.
Research is valuable because it definitely informs how we continue to work with clients, patients, community, and education, and to continue to do innovative and new things as the world is changing and people are changing.
It's talking with people in the community to help us inform better research questions, better research design, so that in the end of the day, hopefully we're creating something that the community would want to adopt.
The department is set up to make a national impact by basically recruiting top-notch scientists to work here, clinicians, and providing a forum to translate that information directly into clinical care.
We provide care to not only the citizens of South Carolina, but to people throughout the United States and actually throughout the world.
Attitudes and treatment of people considered mentally ill has changed drastically over the last 100 years. In the USA, a major contributor to this was the Community Mental Health Act of 1963, signed into law by President John F. Kennedy. To discuss the legacy of the act and where we are today, I'm absolutely delighted now to be joined by President Kennedy's nephew, former Congressman Patrick J. Kennedy. Patrick, thanks ever so much for joining us today.
It's great to be with you.
Tell us a little bit about the Act of 1963, how it came about and what its legacy has been.
Well, my aunt Rosemary, who was the closest in age to President Kennedy, had not only an intellectual disability, she had a bipolar, I think you would call it today. That led her to get the evidence-based treatment at the time, which was a lobotomy. But the whole event so basically traumatized my whole family, but especially President Kennedy. And when he went into the Senate, and then when he obviously took over the White House, he proposed a system of care that was community-based that applied for both those with mental illness and those with intellectual disabilities. But unfortunately, when the Congress ultimately tried to enact it, Congress could only agree on covering people with intellectual disabilities because, of course, the feeling back then is that people with mental illness brought it on themselves. We have been able to, over the years, and now we have a parity rule that's right in front of this country with the Biden administration. The best chance to hold insurance companies accountable insofar as how they treat mental illness commensurate with how they treat other chronic illnesses. So I implore the psychiatric community to really weigh in right now in Washington to get the Biden administration to issue this rule as soon as possible. And if they do that, it will help us advance equity in mental health coverage for this country.
One of the things we've been talking about a lot this week is addiction. And how important do you think the community health approach to addiction is?
Well, I think the community approach, whether you look for mental illness with the Fountain House here in New York, all the clubhouse models are perhaps the most evidence-based interventions, and yet they're not paid for by insurance. We only reimburse for intensive rehabilitation, and that frankly is not enough. We need to build community support so people can reintegrate into the community, get supportive employment, and, as I said, supportive housing.
How difficult and important is it in the United States to have a national mental health approach?
Well, I'm just released a book called Profiles in Mental Health Courage, hearkening back to John F. Kennedy's Profiles in Courage, which highlighted political courage. I think we need courage in people's telling the true story of what it's like to live with these illnesses. In the back of this book, I have a national agenda to how we solve our country's mental health and addiction problems. Housing, criminal justice, human services, CMS, all of these things need to be integrated, but unfortunately, because the budgets are so siloed, we rarely integrate all of the funding to get the best outcomes. So we really need to, frankly, right now is our moment to finally develop a mental health system, not mental health services per se, but a system. And we need the American Psychiatric Association to really step up right now. We cannot wait. This is a formative moment in our history.
Thanks ever so much indeed for joining us today. It's been a great pleasure.
Thank you for having me.
Fascinating insights there with hope for similarly major changes over the next century, and I'm sure APA will be right there as it happens. That wraps up another day here in NYC as you head out for dinner, a show, or just to soak it all in. We're preparing another great show for you with a focus on the challenges and opportunities digital technology presents for psychiatry. And where can you watch it? On screens around the venue, in select NYC hotels, on the APA meeting site, virtual platform and app, and on YouTube and X. We'll see you tomorrow right here on APA TV.